You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please get us started.
Hey, I'm Ivan Zach. I'm excited to introduce my colleague and a fellow Canadian, Dr. Faith Banks. Dr. Faith is a compassionate veterinarian based in Toronto, Canada. With 16 years of experience in general practice, she is known for the expertise in geriatric medicine and pain management for pets. Dr. Banks is the founder of Toronto's first mobile hospice and palliative care service, as well as the city's pioneering Aquamation service. Outside of veterinary work, she enjoys photography, traveling, and spending time with her family and 3 Bernese mountain dogs. Dr. Faith, welcome to the show. Thank you for finding the time.
Thank you for having me.
So tell us, how did you start the business? What was the idea? And let's just start there.
Sure. But first, I'm going to just correct one thing. I was in general practice for 16 years, and I've been focused on end of life for another 12 years.
Oh,
So
wow.
I've been a fair bit longer than just the 16 years. But yeah, so as you mentioned, I was working in a regular practice, different practices for about 16 years. And with my first Bernese mountain dog, she was aging, having more difficulty with the aging process. And I became more interested in geriatric care and pain management. And that kind of led me to focus on geriatric care and end of life. And so I shifted back then and left general practice and started my own mobile service focusing on end of life care. Most of what we do is in-home euthanasia, but also consults to help people with a palliative care plan for their pets. And then about 2 years ago, I opened up another service, which is water-based cremation, also known as Aquamation.
Can you tell us more about that? I heard about this, but I don't know how that works with the mechanics and the advantages over the more traditional ways.
Right. So, I like to tell people that the end result is kind of the same in that you can get your pet's ashes back if you choose or not. So some people choose communal aquamation and some people want private. So private means you get your pet's ashes back. With aquamation or water-based cremation, you get about 20% more of the ashes returned. And it is a more eco-friendly process. So better for the environment. There's no burning of fossil fuels, uses less energy, lower carbon footprint. And so a lot of people are really excited about that part of it, just for the better for the environment.
Well, it sounds pretty fascinating. How does it work?
How does it work? Right. The interesting thing is that so many people think, well, you need flame cremation to get ashes, but ashes from pets or people for that matter are really just bones. So it's not sort of the process that happens to it that makes it into ashes. They started calling them ashes because they were getting those remains from fire, but they're really bones that have been processed. And when we say processed, the word is actually ground into a fine powder, and that's what ashes are. So if you think about that, now I'll backtrack. Flame cremation uses, or traditional cremation, I could call it, uses flame to reduce the body to bone. And with aquamation, we use a special machine, water, alkali salt, to reduce the body to bone. So at the end of our process, we have just bones. They are wet bones, which need to be dried, ground, and that's what your ashes are.
Wow, super fascinating. And so sounds like there's a ton of benefits over the traditional cremation methods. Where did this come from and how did you find out about it and why are you doing it?
Great questions. I've known about it for a while. A lot of people in the end of life care part of veterinary medicine have sort of learned a little bit more and become more sort of interested in this type of aftercare because of the benefits that we see. There are some providers of end-of-life care in veterinary medicine that are choosing to add this as a service for the families. It's a little bit more personalized because we don't have a middleman in this type of service. And so a lot of veterinarians that are focusing on end of life are choosing to add this type of service to the families that they are helping as well.
So your customer,
Yes.
you think about it, is it the end customer, which I assume it is, but is the model to work through existing veterinarians? Are they your referral, or do you market and sell, let's call it, directly to a consumer?
A little bit of both. And so the families that find us through our veterinary service, which is Midtown Mobile Veterinary Hospice Services, about a third of those families are finding us through their regular veterinarian. So they've been referred by their vet. They know that they want to be able to say goodbye to their pet in their home. They know they don't want to bring their pet to the clinic to do it. And so they reach out to their vet to say, will you come to my house and help me with Fluffy? And traditionally, veterinarians were doing that. But because of the shortage of veterinarians, and I think also because of different corporate companies taking over, they don't want their vets leaving to provide this service anymore. So many vet clinics in and around Toronto and the GTA are referring our service for end-of-life care at home or euthanasia. And then the families are finding out about our Aquamation service through our veterinary service or just word of mouth as well. But we don't focus or target our services through veterinary clinics. We are going direct to the pet owners.
Because that's what I was wondering, if it is somewhat competitive to some stuff that they do. In urgent care, which I'm in right now, it's almost a third of our revenue, actually, because of the emergency and the urgent care nature of it. They come in with one thing, it leads to another. And a lot of the times, especially where I'm at in New Brunswick, unfortunately, euthanasias are more common than comprehensive workup and treatment. How do their local vets feel about this service? And I'm sure that there's a mixed bag of, some people that like it, some people that don't. But what is a general perception of the local veterinary community?
They love our service. They really do. And I understand what you're saying. Regular clinics are going to miss out on charging, families for the euthanasia and making some money. I mean, we would like to do this all for free, but we can't. It's a business, it's a service, and, we have people we have to pay. But the feedback that we get from the vet clinics is amazing because we provide an amazing service for their families, a very compassionate and gentle and peaceful passing for their families. And those families have had such a good experience with our service that they are therefore way more likely to say, okay, pet loss sucks, but the experience we had was so good that I'm actually able to get back in and have another pet and go back to that veterinary clinic versus having, a really difficult and heartbreaking experience at that vet clinic and feeling you can't go back to them.
That's very interesting. The other thing that, I've done quite a few studies on burnout, and one of the I think 2 years ago, we compared the burnout rate to every year we compared it to different factors. And in that particular year, I questioned whether euthanasia impacts the veterinarians in a way that contributes to burnout. And the interesting finding that we had was that the economic euthanasia, when people are essentially euthanizing because they can't afford care or, moving or other things that some people do, that significantly impacts and does increase the level of burnout. But what was interesting finding is that most veterinarians reported that euthanasia on its own is a part of a job, and it's not something that increases or decreases burnout. With you doing that exclusively as the service, it's interesting to hear your opinion on that data that we received, and how do you feel this business impacted your life so far?
I think if you came to our conference, which is the International Association for Animal Hospice and Palliative Care, you could walk around and ask people, do you feel you're getting burnt out? Do you suffer from compassion fatigue because of the fact that you perform euthanasia on euthanasia on euthanasia? And the answer would be no. I think there are many reasons for it. One is that the people who do what I do, which is mostly euthanasia, they're not working in clinics. And so we're not going from, an appointment where you are euthanizing the pet for a family that you've known for 15 years. And, you worked so hard in helping that pet and, a surgery you did and medical care. And like you had so much invested in caring for that family and that pet. And then here you are euthanizing them. It would be heartbreaking. And then you walk 2 minutes later to go into a new puppy and you have to be all cheery and happy and, excited, and your heart is just broken. I think that is super hard. In our service, we have about an hour in between each appointment. So I can go be with a family for an hour in their home. I've never met them before. I don't have that relationship with them. I can be compassionate and I can still feel the heartbreak that they're feeling, but I know I'm there to do good and to help them. And then I have an hour to get to my next family. And so I can, call my husband. I can listen to a podcast. I can listen to the radio and just kind of decompress before going and helping somebody else.
Yeah, that makes a lot of sense. I think that just that separation is incredibly beneficial, and the lack of that closeness or the relationship there. So that makes a ton of sense, Dr. Faith. I'm still like, where does it happen? Where does the aquamation happen?
Right. You'll have to come and visit now that, I know you're just around the corner. So we are in Toronto. Weston Road in St. Clair is, I bought a building and we have 2 of the machines there. And so it happens there. The pets, sometimes people will bring their pet directly to us if they've passed at home. Our veterinarians will bring the pets. We pick up the pets from the doctor's home. So there's a bunch of different ways the pets get there. So yeah, we have 2 of the machines there and we do everything there. So the pet never leaves our care. And, I feel that is a really important part of the service that we provide, that they're not sort of going all over the place to different locations in and around the city. They stay in our care the entire time.
That's fascinating. And so, one of the questions that we often ask innovators is like, what's the big, bold vision for this company? Do you see yourself having multiple locations and providing this service across the country of Canada, or what's going to happen with this business?
Well, that's a good question. I'm not one to necessarily look at the future, just in my life in general. It's just something with me. I'm not sort of that 5-year plan, 10-year plan type of person. And so it's a hard one for me to answer. But what I can say is that I want to be able to provide this service for families that want this type of service, whether it's our veterinary care, providing in-home euthanasia, or whether it is aquamation. And so I'm not sure exactly where it will go. But, I know that when I started this 12 years ago, it was just me doing everything. And then since then, I have a team of veterinarians, I have a team of hospice care coordinators, and now this Aquamation Center. So who knows?
That's awesome. Well, that's where I was going with this. There's one thing that you mentioned that I didn't know about. It's, our conference of like-minded people that are doing hospice. It's like the first time I heard that there's a conference of Christmas tree planters. Like there's those, and I met a president of Canadian Association of Christmas Trees. So this is new to me as well, and it sounds like you have a team. So is this in general what is the team that visits the patients? I'm always careful with who do I have, placement of catheter, restraint, and all of those things, especially if it's at home. It's always different setting, even transportation from the home to the car, things like that. So, how did you figure that out? And what is the scalability of this? Because we had, this is not the first hospice service we met before. And
you had Dr. Gardner on.
Yeah. And is it scalable? Is it something that our audience that wants to try something new, the veterinarians that say, I could do something similar here and join your TikTok channel and then learn from you. So what does that look like? Can it generate income sufficient to a veterinarian to switch completely to this service?
Yes. So several questions I'm going to try and answer if I can remember them. So as far as the team that goes out to help families, we actually just send a veterinarian. And I have colleagues all over the US, and I'm very close friends with Dr. Mary Gardner from Lap of Love, who you've had on the show. And most hospice services or in-home euthanasia services tend to send just one doctor. It's very doable. And so I don't think you need to send a technician or an assistant with them. As far as placement of catheters, there are other techniques and routes of injection for euthanasia solution. And so I don't rely strictly on indwelling catheters at all. So, for example, with cats, quite often intrarenal euthanasia drugs are given. The cats are anesthetized first from our pre-euthanasia drugs, but it's just not something that we stress about because we have different methods that we can use. And it's all part of kind of what you learn about when you're focused on this type of care. And so it's a very doable service for a single veterinarian in the home. As far as a veterinarian shifting to this type of service and just doing this type of service, there's definitely a need. And I know the wages that some vets are making in certain practices right now are quite high. Vets in Toronto are getting pulled in many different directions from their clinics they've been at forever to other clinics. And they're being given huge signing bonuses. I don't know that I can compete with that, but what I can tell you is that the work-life balance and the flexibility in this type of service is really attractive to a lot of people. We have a profession of women, and being able to have, a family and being there for your family and having a wonderful job doing this type of care is definitely very attractive to people.
So interesting. It never fails to blow my mind, the different things that this profession does. And I think it's a really interesting and innovative solution that you have with Aquamation. First time I've ever heard about it. But we ran out of time. We always do. It's especially when you get passionate people like you talking about something that they're passionate about, it's easy to chew through 20 minutes. We like to wrap up every episode the same way. We've got a couple questions for you. First is a book recommendation, a YouTube, TED Talk, something that you found interesting and inspiring that you'd like to share with our guests.
Sure. So I remember many years ago when I worked in general practice, I read The Art of Racing in the Rain by Garth Stein. And I don't know if you've heard about it, but it's fiction. It is just an absolutely heartwarming story about a relationship that a family has with their dog. But the dog thinks and is very philosophical and very emotional. And I just remember after I finished, I said to myself, and I probably should sort of stick to this, that, anybody who works for me must read this book, because you start to really look at dogs in a very different way. And you just start thinking that they really understand way more than you think they understand. And so it's just an incredible book. So I love that book.
Great recommendation. And I have a twofold question for you. One is, where can people find you if they're looking for you? And then our usual last question, is there another innovator in the industry that you know that our listeners would benefit from having on this show?
Sure. So my work website is mmvhs.ca. So my service is called Midtown Mobile Veterinary Hospice Services, and we are in Toronto. I also started posting on TikTok about 2 years ago, and I don't know, a friend of mine just convinced me to do it. And I talk about euthanasia, and I talk about pet loss, and I talk about aquamation, and I talk about memorial items, and, everything that you sort of never want to think about when you have an aging pet. But I firmly and so strongly believe that understanding, what is going to happen, and having a plan and being educated about all of this will really make such a difference in your pet loss journey. And so I talk about a lot, and the response that I get back from the families and the people is just amazing. And so they can find me on TikTok.
How would they find you on TikTok?
My username is Dr. Faithbanks. And then your other question was another innovator, and I thought of another fellow Torontonian. Her name is Emma Harris, and she started a telemedicine company in 2016, and she was then brought on by Vetster, which has been around for a little while. But she's currently doing her PhD looking at access to veterinary care. She's doing that at OVC. So I thought that would be, I know you've had similar types of people talking about telemedicine and just, access to care for everyone. So Emma Harris.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.